Good evening, everybody. I'm delighted to be here to officially launch, I suppose, this project that CDS is engaging with Fragile X Association. I suppose I have the privilege of presenting this evening, but I am doing this on behalf of a larger project group. I'm sure all of the Fragile X Association team are familiar to people who are on the call today. So the vision of Wendy and looking at this aging experience really has driven this project collaboration and numerous conversations that Wendy and I had at different conferences and led to the proposal being developed and an opportunity for funding, which is really exciting. Also Liz, Cynthia, Ted, and friend of Fragile X Association, Jonathan Cohn. On the CDS side, I'm joined by Holly Dennehy, who may be on the call. She may not. I know she's attended a couple of meetings already with the team this week. But we're very excited to be involved in this project. And I have got a particular interest in aging for people with intellectual disability. I'm going to start talking about a little bit of context of what we know in this space and really why this project is important. Although anybody who is supporting or caring for an adult child or a sibling with intellectual disability or Fragile X syndrome will know of why this is really an important project to undertake. So if we think about the population of people with intellectual disability, we have this great success story of people who are now living longer, and it should be celebrated. But I suppose the celebration is hampered in some ways because, unfortunately, the health and social care system has not kept a pace in responding to the needs of people with this increased longevity. And we have a growing evidence base over the last 20 years. There's many longitudinal studies on aging in Ireland, in the Netherlands, some very detailed work using large administrative data sets in Canada and as well here in Australia, which are giving us insights into how people age and what it means to age well, but also what are the barriers and what are the inequities that people are experiencing when we compare that aging experience to the general population. We know that there's much higher levels of comorbidity among older people with intellectual disability. And we also know that the aging process is starting at a much younger age than it does for the general population. So we have evidence of people aging or onset of aging-related conditions in their 40s. And for some people with Down syndrome, it's in their 30s. And despite this, there's still a lack of recognition, really, of this earlier aging process and a need for a responsive health and social care system for it. We know that access to health services in general can be very complex for people with intellectual disability across the life course. But there's particular challenges as people transition into adult care and then again into the aging space. We will have all seen reports from the Royal Commission around inequities, abuse, neglect. We know there's data across Australia around preventable and avoidable admissions. So barriers to equitable healthcare are resulting in people going to hospital for conditions that can be managed in primary care, typically, if they're managed well. And we also know there's people with intellectual disability dying from conditions that are preventable and should not be leading to death. Part of the challenge with aging with intellectual disability is that many staff working in services are unsure of what the signs are. And therefore, they're unsure how to respond and to support the person who is aging. Professor Julian Troller in UNSW, who's done lots and lots of fantastic work. And one piece of work that he has done with his team is looking at the content within curriculum for nursing and medical training and the real lack of focus on the needs of people with intellectual disability. So there's a huge gap in terms of education of health and medical staff, as well as disability support staff, and a huge need for capacity building in this space. One issue that I think is always important, particularly when we are in a policy space where the rhetoric is choice and control. The reality is far from that for the people that we work with and the people that we care for and support. And for a long time, people with intellectual disability have been removed from choice in their lives. It can be from everyday decisions, as well as key life decisions. And importantly, within health and housing, people with intellectual disability continue to be denied access to choice and choice-making opportunities in those areas. And we know there's a direct link between choice and well-being and choice and health, where it has got an impact on a person's health, the more choice and autonomy they have over their lives. We also know very well that the networks surrounding people with intellectual disability are very different. So they're less likely to be married, less likely to have their own families, own children, and that family members, particularly aging parents, play a really pivotal role in the support and well-being. In fact, they carry a lot of the load in terms of the gaps in health and social care. And that's not just in Australia, that's in many countries around the world. But parents are aging and there's a need for future care planning. And future care planning is a really difficult conversation for most families. It's a conversation I've been having with my father, who's 75 and cares for my brother, who is 42, 42 this year, who has intellectual disability and lives at home with my dad. It's a difficult conversation. Partly it's difficult because what is there to plan to? What are the options for people beyond the family home? And just yesterday in Ireland, there was a report on future care services for people with disability, and there's actually a real crisis around future residential places. There's over 1,700 adults who are currently living at home with aging parents who will require a residential place in the next 5 years, and there are no residential places. And future care planning can be difficult for siblings as well. Sometimes it doesn't happen and siblings take over the caring role as a default. Sometimes it is planned and siblings are ready to step in, but siblings have other roles as well. And a colleague of mine in Trinity spoke of, we have this sandwich generation of people supporting aging parents and looking after children. But you have the triple-decker sandwich of the aging parents, the children, and your sibling with intellectual disability. So there's layers of complexity in terms of support and care, and what all of that entails in terms of future care planning. Some of the systems issues that continue to challenge successful and aging well for this population, and that prevent families from really preparing transition plans and future care planning that they are happy with, that they feel confident that their adult child will be taken care of and supported and have a life of their choosing, is because disability and aging continue to be siloed at a policy level, at a system level, at a funding level, and in services. So if you think about age-related services and age-related policy, typically it's at age 65. We have a population of people who are aging from age 40. Disability services are not necessarily prepared for the aging and the onset frailty that may be incurred. And aging services are not available to people who are younger. As I said, there's a lack of acknowledgement of this specific aging experience of people with intellectual disability and the kind of responses that are needed within health and within the housing system. Annual health assessments and screening are not happening at a rate that they should be. Therefore, conditions that should be picked up at an earlier age are not. And this concept of aging in place, which is quite dominant in policy worldwide for the general older population, and there's research to show that aging in place, so staying where you live or choosing or having choice over where you live as you age, has huge benefits in terms of your social connectedness, your quality of life, your well-being. But what that means for people with intellectual disability is unclear and hasn't really been tested in policy. And what it means for people aging in place with their aging parents has also been an issue that's left unexplored to date. So we know a lot of information about this aging experience and issues and challenges that are there for families and for individuals and other caregivers. And this study now is really a spotlight on adulthood and aging for individuals with Fragile X syndrome and their families. And I'm sure there's issues that I've raised that family members on the call or professionals on the call can attest to. Part of the drive for this project was that Fragile X Association, Wendy, Liz, Cynthia, have got increasing demand for advice and guidance from families and from services. There's increasing requests for education and training. And this issue of future care planning is raising its head of what can we do, how can we plan, and how can we avoid crisis? Many people with intellectual disability are at risk of homelessness. They're often the invisible population within the homelessness group, because homelessness is more than sleeping rough. It's in being in inappropriate housing, unstable housing, insecure housing. If your only home has been living with your parents and there's no future care plan, there's no future housing plan, you're at risk of homelessness. And I think it's a major issue of concern. I think what's really important about this study is that it's a national study, and we're hoping to identify care needs and gaps in services as they currently present, but also what families and individuals anticipate will be the future care needs. It has significance on the international stage as well. We've had a number of conversations with European partners, partners in the States, in New Zealand, and the fact that this study is happening is a great gift to them also, because there is a real lack of data and a lack of focus on this issue for the specific population. And so there is a lot of support for this study and a lot of people anticipating and waiting for data to come through to support policy change, advocacy, and to inform better practice. Just to highlight the specific objectives that we set out for this study was exploring the need for the effectiveness of supports for adults, looking at adults in residential settings, group home settings, but also for those people living at home with family, be that parents or siblings, exploring the issue of future care planning and transition in later life. A central part and a real key output from this project will be educational resources. And Wendy and Holly have recently had meetings with the team in UNSW who will take on that role, and we're very happy that they will be engaged in that space. We have a desire to create a community of practice so that we can continue with this ongoing learning and support as we tackle these issues. And really, there's a desire for advocacy and policy change and to really acknowledgement of the need to respond to the aging needs of people with Fragile X syndrome. The study will run over 3 years. We're in the very early stages. We're going to use a number of different methodologies. We are keen to hear a diversity of voices, a diversity of experience, from professionals to families to individuals. And for that reason, it's really important that we use different approaches, be it surveys, interviews, focus groups, or creative methods. So something that we are very passionate about in our centre is looking at creative methods, how to engage people who maybe are nonverbal or have few words or prefer to express themselves through photograph, through art, through other creative means. So really to be flexible and as inclusive as possible. The project will be co-designed with experts who have lived experience in this space and professionals. And we want to hear from, as I say, a diversity of people. So that's people living with Fragile X syndrome, the family members who are supporting them, and also the professionals who work to support them and are in services, health and social care services. Cynthia, I think I'm going to hand over to you to make a plea for getting involved.
Yes, so we're really excited about this this research study, and we were absolutely thrilled to get the funding for it. So we want to get as many families and individuals as involved as possible. So the kinds of input we're seeking is from expert advisors who give us advice about how to do the research, co-researchers who are going to help and design and do the research, but particularly as participants. So we're reaching out to families and individuals living with Fragile X syndrome to answer the questions in our surveys, in focus groups, by interviews, online surveys, really with whichever method you feel comfortable in participating. So we want to tell others about the research, ask them to take part. So, you know, if you know of people, for instance, who haven't logged into this webinar today, and let them know what's happening. And the more people we can get that information out to, the better will be the results of this study, because the more information we have, the better we can look at the information and I think have some really good results and some really good resources.
Okay. Thanks, Cynthia. And I'm just going to finish with leaving our email addresses there. We've included Liz, Wendy and myself, and you can contact any of us if you have questions, if you're keen to get involved. Yeah, we'd love to hear from you. And thanks everyone for your time this evening and your attention.